So let's dive into data science and its social impact. And let's talk about what data science can do for our world. So with the right tools, knowledge, and talent, basically, so if you have the right data science tools and the talent, you want to have people that understand their background and maybe their inherent biases and have the right knowledge of everything, you can use data science to generate a positive social impact. And the last 2 weeks we talked about, let's see, one of them was the refugees, or sorry, not refugees, the parolees and their risk assessment and how using historical data, their risk assessment for reoffending was higher for those of color. And maybe that wasn't such a positive social impact because we're further marginalizing these communities, which is not good. And we also talked about how Google searches have inherent biases, which also further marginalize our vulnerable populations. So we want to talk about what data science can do for us. So I want to kind of open the floor and ask you guys, what are the risks of not doing data science? And what do you think? Do the risks outweigh the benefits? Do you think data science is creating more harm than good? And there's really no right answer, but I kind of just want to see where you guys are, where your head is at in the whole realm of data science. Yeah, transparency of information, absolutely. Absolutely, Claude. For me personally, and I'm not the end all be all to this, but my opinion is that data science can provide us with, you know, the bigger picture of everything. And I do really believe that when you have the big picture, you can make better decisions. Martin says making bad decisions. Risk of not using data science allows for people in charge to be overly influenced by potential biases. I absolutely agree with that. Absolutely. And that's the thing, it's the most important thing as a data scientist. You have to understand that your background, you're strongly influenced by your background. So you really need to understand maybe inherent biases and kind of look outside yourself and see, you know, what you can do to do better and maybe what you're not seeing in the data that someone else would see. Stephanie says, I work in the personalized medicine space and there's tremendous potential to use data science. Absolutely. We talked about the metastatic breast cancer algorithm 2 weeks ago, I believe, and that is just completely awesome. That is just, it's helping doctors. They're able to go faster, reach more patients, and personalize care. Not only just personalized care, but actually provide more access to care. So that's a really awesome thing. Yeah, I like your guys' ideas. I agree with them. So I want to talk about data science's positive social impact. So my team and I were locally based in San Diego County. We're all spread out, but we're in San Diego. So these are just some examples of how data science is changing the landscape for us in San Diego. It's helping with our poverty. It's helping with homeless. We talked about healthcare. It makes the city more accountable for how they're spending money, which is good. For those of you who maybe know, California is, or Southern California is constantly in a drought. So we're able to use data science to kind of distribute water through a distribution system as we need it, which also leads us into our fire problem, which is very linked to global warming. We're able to use data to effectively fight the fires better. We're having an unprecedented season this year. And we have an opioid epidemic, and that's pretty nationwide in the US. And also, as a coastal city, it's helping us protect our marine biodiversity. So and these are just eight examples, but data science has a huge reach across many industries. Let's see. Vinay says gives more insights from any structural. Yes, absolutely. Vinay, it does give more insights from structured and unstructured data. Yeah. Once you know how to work with the data, it provides so many insights and you can really see the bigger picture. So I want to focus in on the opioid crisis, which has hit the US pretty hard. And especially with COVID, our numbers are going up across the nation and including San Diego for opioid overdosing. So I want to focus on 3 specific examples of case study success that we've had using data science to fight this pandemic or epidemic. There's 128 people every day that die in the USA. That number's from 2019, and I believe that number's increased. And these are 3 different very locations across the country, and they all harness their data and they're able to reduce their numbers. So it's super awesome how they're able to do that. Yeah, Teresa, wow, is right. Arizona realized had a statewide response, which is really cool. They recognized that their opioid epidemic was linked to prescription patterns, and I believe the statistic at one point was there was enough prescription opioids to go around for all Arizonans to have 1 pill a day for 2 weeks, which is crazy. So they were way over prescribing them. So the governor declared a state of emergency, and they used real-time data publication, and they were able to see how their response is going, and they were able to, sorry, my kid's going, and they were able to shape the response and see hotspots using geospatial analysis to implement treatment and areas based on need. And they're able to highlight everything and then really hone in on those areas and fight this epidemic. Cincinnati, Ohio had a slightly different response. They made a dashboard and they're able to track ER calls for opioid overdoses. So every time a call came in real time, they were able to update their dashboard. And they were able, after that, to look at these hotspots and establish where exactly they needed to do aggressive Narcan distribution. For those of you who don't know, Narcan is it's the antidote to an opioid overdose. Opioid makes your respiratory system slow down until you stop breathing, and it also slows your organs and everything. So Narcan actually will reverse it. It usually comes in a nose spray. So they were able to provide that in the places where they needed it the most. And they amazingly had a 31% decline in emergency medical responses, 42% reduction of ER visits, and a 31% reduction in overdose deaths. So they really did an awesome job. Omar says in Arizona here, now I know why I couldn't get some prescription pills. Yeah, absolutely. On a serious note, you can get strong, only you get it from certain locations. Yeah, and yeah, Omar, you absolutely. And I really think that's because the governor cracked down because they saw that they really had a problem on their hands. But that's good. That's good. And in Pennsylvania, they used descriptive data. So they had a really different approach with their data, but a really cool one. They use descriptive data to identify the patterns and characteristics of the users. So they're able to kind of find out inherent traits that maybe someone who will likely to develop an addiction. And then using those traits coupled with autopsy data to figure out the locations of these people with these inherent characteristics, they were able to go and target places where they should disperse the Narcan, the anti-overdose meds. And another really cool thing is that they shared their data, which in a lot of cities, kind of the data is broken into by departments, but they're able to do a cross-departmental approach, and they shared their data across everything, and they were able to reduce their emergency response time. So that is a really awesome way, and it's 3 totally different examples on how people are using, or these different regions are using data science, but they've effectively been fighting this epidemic. And let's talk about, for those who are local to San Diego, we have a San Diego opioid project. San Diego's, we're up to 3 deaths a day in San Diego due to COVID-19 with our epidemic. And San Diego's response to that is to provide a data-powered campaign to educate and change behavior. So what we're trying to do is we're going in, or the opioid project's going into high-risk groups, and they're determining who is a high-risk group, and then they're targeting digital ads through social media. So you have to come in San Diego. They're making a start, but compared to the other success stories, what do you think San Diego can do to better combat the crisis? Do you think we could be using our data in other ways? And remember, San Diego actually has a lot of available data. We're really open to providing public data. So we have the resources. So I want to ask you guys, is there any way we could maybe tackle this epidemic here any better? Absolutely, Isabel, absolutely. Better storytelling with the data, not just throwing data at people. I agree. It's great. Yeah, it's great to educate them. And I think that's an important part. But yeah, you need to make sure they see the whole story. Yep, testimonials, absolutely. Actionable insights. There you go. More than charts. Exactly, Matthew. Yeah. So the insights are great. And I do think that maybe, of course, those are going to help. But I think, yeah, what Matthew says, the actionable insights are going to be really effective. They really probably want to use that data and see where this is happening throughout the county and try to, you know, put up crisis centers there and do their Narcan distribution in those centers, right? Yep, Teresa says actionable insights. Yep. I'm so proud of you guys. Good job. All right, let's go to the next one. And for our, oh, sorry, Stephanie says, present the data and impact in a context that appeals to people's underlying motivations in business. It would be company goals. There's got to be an equivalent for public health too. Absolutely, there is, Stephanie. There is an equivalent for that. Yep, underlying motions. Yep, so that would be kind of like Pennsylvania's response, Stephanie, where they did the underlying characteristics and they're able to target who they could determine by their characteristics would develop an addiction. Absolutely. And let's go on to our second example before we start our Tableau introduction. We have a little case study on refugees. So refugees are, you know, a worldwide humanitarian crisis. And unfortunately, they've been wrongly labeled as, you know, burdens to the systems that, you know, they're fleeing, you know, to the countries that they're fleeing to. So what I love about this case study is that Switzerland teamed up with immigration policy labs. There's branches and they use Stanford, they use Zurich, and I believe a data scientist from Dartmouth College to create the placement algorithm. And their logic when they were creating this algorithm was, you know what, let's not treat refugees like the quote unquote burden that the governments think they are in society. Maybe the governments are the problem. And what we've been doing is just trying to put them wherever there's space in our systems. But what if we actually match them up with a place that, with their characteristics, maybe somewhere where there wouldn't be a language barrier for them, maybe some places where they have a community that would speak their language, and that would set them up for really success in assimilating and employment success. And so they came up with this really cool algorithm that has a really high probability rate, and they're doing much better than they can. Okay, and I want to just divert your attention to the right here. This is a really cool graph, and you can make these on Tableau. And Jesse, if you have any questions on how to make these, Jesse's the expert. On the left side of the circle, those are the countries, the top 10 countries that refugees are coming from. And on the right side, those are the countries that the refugees are fleeing to. That's the top 10 plus the United States. And I just wanted to point out that we always hear about Syria and Afghanistan and what on the news, but look at all the other countries that are in the top 10 that we don't even hear about. So, and it's just crazy. And the US has such a tiny sliver, and each of the threads going from the left to the right, that's showing the flow of where the refugees are going. And the thicker it is, it's just representing the more refugees that went. So let's talk about the algorithm that they use to send the refugees. So I just want to point out that the United States and the European Union, they're alike in the sense that they just have random assignment for refugees. And so this is kind of what has been so groundbreaking about this algorithm. So on the left side, you have your placement algorithm, which was shown that data science was used to optimize employment prospects for the refugees. And then the scientific methodology part on the left side means that this is a repeatable algorithm. It absolutely works, and you can keep retraining it. And so refugee data was curated to generate these parameters, which could influence the predictions it has. And in the probability outcomes, it factored in things such as skill sets, personality traits, and geographical context, which historically have never even been a consideration for where you're going to place everyone. And then in the middle, you have the actual model itself, and that model is always improving. Anytime there's new data, you can throw it back in and you can retrain the model and it will spit it out. And the algorithm prediction, it came out to incredibly increase refugees' employment by 41% in the USA and 73% in Switzerland. So, when you put people in the right place and give them, the best opportunity to succeed, it shows that you really can succeed. And, people want to assimilate and they want to, have employment. So this is something that is really helpful. And it is an iterative process, like any machine learning algorithm. You just keep feeding it back in and it keeps learning and it spits out better predictions. And they are data-driven decisions, not meant to replace any placement officer. It's meant to complement their decision on where they should go. Say if the algorithm spits out 3 places, then you can trust the placement officer that they can speak with refugees and talk about which area might suit them the best for their needs of their lifestyle. So this is just a really great way, I found, to deal with the humanitarian crisis that we have on our hands right now. And that pretty much is it. Let's see, do we have any questions? Okay, we're going there. So yeah, I want to thank you guys for going through all these examples with me and being so interactive.